Welcome to the Skin Crest Clinic Dermatology Podcast. I am your host, Dr. Praveen Banodkar, consultant dermatologist practicing in Mumbai at Skin Crest Clinic. I thank you for joining the podcast that covers everything related to skin, hair and nails. In this episode, we would be discussing about sudden acute hair fall. Both men and women are presenting to the clinic nowadays with a complaint of sudden increased hair fall. They report a dramatic and abrupt drop in the hair volume and present with great emotional distress. They are specifically concerned about the large number of hairs they shed every time the hair is washed or shampooed, combed, oiled, or even if they run their hand through their hair. Out of fear of getting bald, they stop combing their hair or even washing it and then sometimes present with matted hair. Many have experienced this, especially if they have had COVID-19 in the past 3 to 4 months. This condition is called acute telogen effluvium. It is a common entity. This is similar to what we have seen earlier and even we are seeing now in conditions such as post-pregnancy period, post-high-grade fevers like typhoid, malaria, or even post-crash dieting. This kind of hair loss is common and is called as acute telogen effluvium, where patients typically report significant hair loss and a decrease in the hair volume without any well-defined alopecia patches. This occurs fast and this is why it feels so traumatic to people who go through it. This type of sudden hair loss may have you finding clumps of hair in the shower drain, on the floors in your bedroom, in your hairbrush, in your pillow covers and even in your hand. But fear not, friends, there is a good news regarding this condition. It is a reversible type of alopecia and resolves after the trigger stops. What are the treatments for this condition? First things first, the best telogen effluvium treatment is to remove the stress that causes it. You should speak to your dermatologist so that they can define the condition for you and find the treatment for it. Calming the stress, anxiety by yoga, intake of probiotics, exercise and increased water intake, eating good amount of fruits, vegetables, sleeping adequately and doing regular physical exercises can help. The acute telogen effluvium can be controlled with increased intake of proteins in your diet. If you're non-vegetarian, intake of egg and meat can help. If you're a vegetarian, increase intake of dals, pulses, sprouts, paneer, soya can also help. Application of good hair serums suggested by the dermatologist can do wonders for this condition. Please remember, do not fret. It is a reversible condition. There is no scarring involved. However, it is important to take appointment with your dermatologist as early as possible. Hope you enjoyed listening and gathered some valuable take-home messages in today's discussion. Thanks for tuning in. For dermatology appointments, you can send a WhatsApp on 9867 955 944. Take care, stay safe and stay healthy.